Why is my dog vomiting? And what should I do about it? I'm Dr. Alicia, and today I will answer all of those questions. So, stay tuned! Before we start, please consider subscribing to the channel and hit the notification bell as well. That way, you will be notified as soon as we release a new video that will help you become a better pet owner. Vomiting is when your dog forcefully injects the contents of the stomach or the upper intestine. It's important to know the difference between vomiting and regurgitation. A vomiting dog may show abdominal heaving and nausea. Dogs mostly regurgitate soon after eating, and it's a mostly passive process. The dog simply lowers their head and food comes up, without active abdominal contractions, like in vomiting. The food expelled during regurgitation is usually undigested and without bile. However, vomit is partially digested and has some bile. Your dog will almost always try to eat regurgitated food. Dog vomiting may happen for several reasons. It could be that your dog ate more than he could handle, ate too fast, or he has eaten too much grass. Sometimes the cause could be more serious. Your dog could have swallowed something toxic, or it may be a sign of serious illness which could require visiting a veterinarian. Why is my dog throwing up? Here are some possible causes of a sudden or acute episode of vomiting: intestinal parasites, bacterial or viral infections, toxins or poisons, diet change, food intolerances, foreign substances or objects in the gastrointestinal system like toys or garbage, pancreatitis, reaction to a medication, intestinal inflammation or obstruction, constipation, bloat, kidney failure, liver failure, uterine infection, heat stroke or cancer. Is your dog throwing up frequently? Frequent throwing up can be a sign of serious medical condition. Watch for the symptoms such as these: abdominal pain, weakness, vomit with blood in it, depression, weight loss, dehydration, fever, continuous vomiting, chronic vomiting, vomiting a lot at one time, vomiting with nothing coming up, bloody diarrhea, suspected foreign body ingestion, seizures. When should you call a vet about a vomiting canine? If your dog is throwing up with any of the symptoms we mentioned above, take him to a vet immediately. If your canine friend throws up and continues eating with normal bowel movements, it might just be an isolated incident. However, if your dog is vomiting and not eating, you should check with your vet to rule out any serious conditions. Most of these conditions are very treatable, especially if they are addressed in the early stages. Remember that the majority of the issues caused by chronic or frequent vomiting will not go away on their own and require the intervention of a veterinarian. What if you have a puppy that is throwing up? A dog vomiting is potentially serious, but a puppy vomiting should always be treated as a potential emergency. After 6 weeks, puppies lose the immunity given to them by their mothers. Since young puppies only just begin receiving vaccinations, they are at increased risk of contracting serious diseases like a parvovirus or parasites. If your puppy is vomiting, don't wait to see if it resolves on its own. Call your vet. The last question you may have is: can I give my dog any over-the-counter medications or home remedies to help with the problem? The answer is no. If your dog shows any of the symptoms we discussed above and does not seem to get better, do not take it upon yourself to deal with it, as you might only worsen the situation. Please take your canine friend to a medical professional instead. You know your dog's behavior best, which is why it's up to you to fill your veterinarian in on anything that could have contributed to your dog's condition. This could have been an access to human medications, toxins, a change in diet, and other possible causes. Be sure to follow your vet's recommendations to keep your dog safe and healthy. That's it for this episode. If you enjoyed the video, drop me a like and we'll see you soon. Bye bye!